What is up, you guys? Welcome back to the Curated Beauty Podcast. I am your host, Jessica Christie, and I admittingly have been absent for a while through the holidays and doing year end review with my team and just developing some really exciting growth maps for what 2025 has in store for both beauty culture and cultured wellness functional medicine. I am just honestly really excited to connect with you today, share what's kind of been going on behind the scenes, and just catch you all up on what I've been doing. I do get stressed out when I'm not consistent with the podcast because it's something that I know doesn't move the needle a ton, but I know that there are some people that reach out and say that they love the podcast. And it's also something that I've just made a commitment for to myself and to you guys that want to hear this information. I think it's just such a great place to share the inner workings and the deeper stuff, peeling back the layers. And so today, before we dive into a topic on the aging process and how it impacts both medical aesthetic treatments and functional medicine, including hormones, I really just want to give you a quick update on what I've been up to. As many of you know, I have been leading our incredible Michigan team remotely from Florida. If you are watching this on YouTube or watching this live, you'll notice the very tacky coastal Airbnb flair that we have here. I am on the Gulf Coast of Florida, and it's been both rewarding and challenging to stay connected with the day-to-day operations while focusing on our long-term vision and really continuing to bring clarity of what that looks like to our team, and also just becoming the premier destination for both medical aesthetics and for functional medicine. Recently, I had the privilege of attending a strategic coach workshop in Chicago. This is something that I joined this past year. I've been a long-term fan of Dan Sullivan. Something that really came up for me, The Gap in the Gain book, just revisiting that. Casting, not hiring. I really have had some swing and misses with hiring this year. And just really being able to think of it as more, how are you casting onto your team rather than just hiring? I don't know. It's just amazing. And multiplication by subtraction. This was another book that I brought home. And just really talking about how to gracefully let go of wrong fit team members. It's no surprise or secret that I have had a lot of turnover in my business that is quite intentional. And as we got more and more clear about who we are, what we stand for, and where we're going, it naturally, in a positive way, has really allowed us to see, do we have the right people in the right seats? And so part of the end of 2024, I went to my first strategic coach meeting in October. And man, I didn't think it was as impactful as I realized it was after the fact. When I went to my second meeting and I realized, wow, there were so many who's that were missing from my team. So, who are we hiring to do things, not how am I going to do more so that I can focus in my unique ability? Um, we have we have filled a lot of those seats. We've cleared out some that do not serve us, and we have really moved the needle in terms of honing in our leads and sales process and adding someone who has been incredible at stacking all of our technology and making sure that things are talking to each other just as all the team members on our team do. Huge win for us is that we are implementing EOS, or the Entrepreneurial Operating System. Fun fact, the guy who founded that, Gino Wickman, is a long-term client of Dan Sullivan and a strategic coach. And so it's just so cool to see the synergy of how all of these things are working together and how all of these really impactful strategic partnerships are affecting one another. And I think, looking at my team, each team member as a strategic partner, and looking at all of our patients as strategic partnerships is really, really exciting to see the cadence pick up and the steam pick up and just really a lot of momentum. I got to tell you, it was like putting wind in my sails to go to that. Every time I attend these workshops, I walk away with fresh tools, reinvigoration of tools that I didn't fully understand, strategies, and something that kept coming up for me was clarity on how to really refine our processes and how to elevate our patient experience. And this session, was really no different than what I had felt in the past or what I felt with other coaching. It reminded me of why we're not just another aesthetic practice. We are the choice for patients who want comprehensive care, both inside and out. And the inside part, the whole concept of functional medicine is a newer thing for us, which is really, really exciting. We're not just offering aesthetic treatments, we're here to truly transform lives and combine cutting edge science, artistry, just really deep understanding of what's going on with the aging process at every single level. And that's exactly what we're going to be diving into today. So, back to what I promised this episode would be about the aging process and really how it impacts our medical aesthetic treatment choices, the guidance, what we complement it with. When you think about the aging process, you really need to understand how aging affects all levels. Again, both inside out, from a very concrete aspect of the layers of the face. And it doesn't just show up on the surface. Truly, it's happening at every level on our tissues. And I think that you would just be so amiss to really ignore that opportunity to educate your patient when they come in saying, "Hey, I'm noticing that I feel tired." That's probably structural opportunity education to talk about how the eye is changing, from a bony level, from a skin level, from a fat pad level, from a muscle level. All of those things are super important. And these changes, from bone and fat and muscle and skin and vasculature and glands, these changes are really, really interconnected and they create these visible manifestations of aging that we then see as the mirror as patients and consumers. So, a quick breakdown. Um, there are, for the most part, 5 layers of the face. Starting the most deep layer is the bone. And as we age, your bone does change. I will never forget one of my patients that I no longer get to see, but she's still at the practice. As I've kind of elevated into this leadership role and out of patient care, I miss those patients so much. But she said, "You know what? I feel like as I age, my head or my skull is widening and shortening." And I was like, "You are so smart because that's exactly what's happening." The chin recedes, our piriform aperture, which if you put your finger right beside the nostril between the nose and the cheek, that widens. The orbital rim expands. We lose volume in the upper inner part and the lower outer part. And these changes really affect how all of the tissues that are laying on top of them are sort of draped over the bone. And as we lose that bone, or as we see flattening of the gonial angle or in the back of the jaw, as we see, like I said, that piriform aperture widening, you'll start to see the changes and the lines that are created from that loss of support. Talking about the deep and superficial fat pads, so those are 2 more layers. There's a muscle sandwiched in between the 2, but the deep fat pads are ones that actually just shrivel and deflate over time. So if you take a pillow in a pillowcase and shrivel it up, the pillowcase is not gonna be nice and taut and bouncy anymore. You're gonna be like, "I need another pillow." The superficial fat pads that lay on top of the muscle, those are going to descend. So when I like to teach, I say deep fat pads deflate, superficial fat pads descend. So those superficial ones that are descending, those are going to lead to things like flattening of the cheeks, jowling, just volume loss overall with the combination of those two things. Muscle, I talk about this a little less, but muscle with age, it thins, it weakens, or it can be overactive in certain areas, like people like me that talk a lot. That can deepen wrinkles or change the facial expression and really, really impact how we perceive youth and what we're looking at with the aging process. And then we have another really, really important one, which I have a very strong passion for, which is skin. So, skin, we look at the epidermis, which is the outermost layer that you're looking at. And then the dermis, where we have the collagen, elastin, fibroblasts, the structure, the hair follicles. And with the skin degradation and with the loss of collagen, with the loss of elastin, we're leading to wrinkles and laxity and textural changes. And so if you're choosing a provider, ask yourself, do they understand the layers of the face and how they work together? And you would know this if they're educating you on what's happening. You come into the office and you say, I feel like I look angry. Well, it's probably an issue around the lower face. Maybe you're pulling up and you're saying, I just don't like these lines, or I don't like my nasolabial fold. These are deep. Is your provider then using that opportunity to really not just show you what's visible and putting a band-aid on that, so to speak? In the olden days of injecting, we just kind of used to caulk that area with some dermal filler, but we weren't treating the root cause of why that was happening, which is loss of the other tissues and layers that I mentioned just previous to this, and really thinking of a way to address these layers strategically. So why does education matter? This is the heart of what we do. And when I was a brand new injector, I have to admit, and it's okay if this is you because you're going to change after today, or you should be injecting if you are going to admit this, I guess I should say, but you need to go back to the drawing board. I didn't even know the names of the vessels in the face. I could not map them out. I went to PA school, I did cadaver dissections, I learned them, I memorized them, and then left. And then I didn't really think about the facial vessels until I was in a dermatology PA practicing medical derm and had an interest in facial injections. And then really kind of just the trainings that we used to have, they were not anything close to what we offer now. And so now we're assessing everything. We don't just know all of those vessels inside and out and where they lay and where they originate and where they end and the varieties anatomically. We know the ligaments, like what is holding all this stuff into place, what's extending from the bone to the skin and kind of giving that structure. We know where the fat pads are. We know what they're called. We know what we're trying to augment because dermal filler is actually supposed to be really replacing those fat pads and bringing the shrinkage back together so that we can offer that support. So yeah, we've built our elite patient journey at Beauty Culture around this in-depth knowledge, making sure that every treatment is truly tailored and comprehensive and really aligned with what's happening beneath the surface. So for example, when we evaluate a patient, we're just not thinking about, oh, you need this much Botox or this much filler. We're considering not only the education of all the things that are happening in the face, but why are they happening? What's going on with your hormones? Are you perimenopausal or menopausal and you're noticing the changes in the estrogen drop and how crepey your skin is? What's your diet look like? Is your gut a wreck and you're having, perioral dermatitis and your dermatologist giving you steroids and it's making it flare, or all these other expensive prescriptions that really are just putting a band-aid on the issue? Is your skin full of flakiness, like big flaky eyebrows, seborrheic dermatitis? Are you struggling with hormonal acne? Do you need a detox? What is your stress level? How much are you sleeping? This is why we expanded into wellness, because a healthy, balanced body is really a foundation to achieving optimal results in any of the other treatments that we do. I used to have the slogan, helping you look the age you feel, because so often at my age of injecting when I was really young, I would hear people say like, I am, 56, 57, 60, but I just feel like I'm 30 still. Like I can't tell you how many times I heard that. And I will say that that really resonated with a lot of people. But what do you do when someone says, I actually feel 80? Because I have insomnia, joint pains, gut issues, anxiety. All of these are going to actually take a toll on your confidence, and they're not going to help you put your best foot forward and show up to do all of the deepest desires of your life because you feel tired and you look tired. And at the end of the day, what do I really want to do? I want to restore confidence. So our treatments aren't just about looking younger. They're about helping people find themselves again. And this is why we started Cultured Wellness as a great sister to Beauty Culture. this is going to help patients just balance all of these things, the hormone deficiencies, heal the gut, address metabolic dysfunction. And when we treat the patient inside as well as the outside, it really creates that synergy that boosts confidence and gives the patient the zest to just get that pep in your step and live your life to the fullest. I really, really, really encourage anyone who has been a longtime patient of beauty culture to give cultured wellness a shot because I have realized myself and so many of my other female patients and friends, you actually don't realize how crappy you feel until you start to feel better. We put up with a lot as women. And when you start to see the veil lift, you're like, holy crap, you're almost like anxious about the fact that you didn't find this out sooner. I will also say that over a year of hormone replacement therapy, I can now see massive changes in my skin. I'm incorporating some other things too from a regenerative standpoint that I will share more about in the future, but they are things that we're offering to our patients at Beauty Culture. It's very, very exciting. So, um, the elite patient journey. When people come in, they get this full rundown education, prioritize what the patient is looking for because really patients want to be understood and heard and feel seen. And so a number of years ago, I actually wanted to get a rhinoplasty. Well, actually, I wanted one forever, but everyone kept telling me that you don't need one, you don't need one. And one thing I've learned in life is don't listen to anyone. Don't listen to anyone. Do it. You do you. So, I went and saw a surgeon that was recommended to me, one that I felt like I trusted. He gave me a folder with a whole bunch of resources. Expectations were in there, product recommendations to get me through, just contact information, a healing journey, what to expect. And that folder wasn't just a paper that I walked out with, it was value. And I should be getting value because I'm spending thousands and thousands of dollars on this rhinoplasty. So I referenced it many times through my journey of healing from a rhinoplasty. I remember there was an emotional roller coaster sheet. And around day 4, when I was feeling like, what did I do? What did I do? I remember ruffling through the folder to find this sheet that he had told me about. Like, there, you're going to feel different stages. There's this little map of how you're going to feel. And I aligned with what was exactly on the map. Like, you're going to be questioning your choices. And it was so reassuring to me. And I will never forget that. And I have recommended this surgeon time over time over time, not only for my good result, but not once has my leading point to recommending this surgeon been because the price was the cheapest. I actually told him I would have paid double because I got what I wanted. I got perceived value and I felt very, very taken care of and seen and heard. So this inspired me, amongst other things. There's a lot of resources that I took from to really delve in and create the elite patient journey at Beauty Culture. um, I wanted to create something similar to our patients because I don't sell on price, I sell on value. I want you to feel like what we offer is so dang good that you really would be silly to go anywhere else. We're not just providing treatments, we're providing massive guidance and education and long term plans that really feel relationship based because they are. Patients are not just coming in and getting Botox. And in fact, there have been people that say, like, yeah, well, a lot of people can get Botox now. And so we just go where we can get it the cheapest. Go. That's fine. That is so okay in knowing thyself. Like, I can only see so many patients in my practice, and there's going to be a place for everyone. But with our patients that want that deeper value, they're trusting us to guide them through their anti aging journey over months into years. And let's be real, it's the value that sticks. When a patient takes this elite patient journey paperwork in this folder and they walk out of my office, I want them to consider, is there somewhere better for me? Is this the place for me? I want them to really feel like this is the place for me. And when they share this comprehend or compare this comprehensive process to how another clinic does things and potentially offers the cheapest price but no support, who do you think they're going to remember when they're finally ready to call and make that appointment? they look in the mirror one last time and say, I just can't do this anymore. I feel old and tired and sad and depressed, and I just don't feel good. And I feel like, who's going to be the one? These people. They gave me a folder, they gave me a contact information, they told me to call when I'm ready, and I'm here. Um, so I think that a huge part of our process during the elite patient journey and beyond is just listening to our patients. We ask open-ended questions so that we can really seek to understand why they're here. And again, are they saying things like my face is falling? Are they saying things like emotional based, like I just feel like sad, or whatever they may be saying? This is a sign that their confidence is taking a hit. And by understanding these priorities and asking for their input on this, we can create this personalized long term treatment plan that really truly delivers results. This is where sort of that motivational interviewing comes in. It's about listening to understand, not just listening so that I can, when are they going to stop talking? I need to respond and put my 2 cents in. Um, you know, why we do this is very well, it's getting more and more accepted, I should say, but I will like to just point out, and I've said it before and it's a little unsettling to people. I want you to know that aging is a disease. And I'm going to talk a little bit about why aging is a disease and how we help patients kind of dance with that, but it always ends the same way. Aging always ends with the end of our life. But how you dance with that concept is up to you. And our practice is here for people who want optimal health options. They aren't just looking to live their life, whenever my time's up, my time's up. They want to live life to the fullest and the strongest. So, for example, optimizing hormones doesn't just improve skin quality, it transforms your energy levels, it transforms your mood, your sleep quality, your overall well being, your risk at cardiovascular disease, which is the number one killer of women over 50 still. And why is that? Why are we not putting the association together? Beats me, but we are seeing the data shows that when women are on bioidentical hormone replacement therapy within 10 years of going through that change called menopause, that our heart disease risks are dropping, that our cancer risks are dropping. There's so much misinformation out there, you guys, and we are ready and available to educate and to make sure that you feel really good about your choice to bring something like hormone replacement therapy on. Um, when we look at addressing mid-face volume because of the aging process, addressing mid-face volume, which is like your cheek volume, your cheek filler, that's going to affect how the lower face looks. Same principles apply to wellness. Everything is connected, and we're here to guide the patients through all of that and teach you how those things are intertwined. Another thing is we have a medical weight loss program that I believe we do best. I love our essential commitments. There are very few other practices that I would say I think do medical weight loss as well as we do. It makes me sad that there's like minute clinics open that are just pumping out peptides and killing people's appetite and not teaching them about protein ratios and how to really send your muscles signals to build that proper tissue that give you skeletal muscle longevity on your life. With that, you may lose some fat in your face. Guess what? Then, from an aesthetic standpoint, because now you're metabolically optimized and you're doing so much better, you look better, you feel better, you have more energy, your joints ache less. Hey, listen, if you have a little bit of mid face loss because of volume loss, because you've lost 50 pounds on your body and you're going to keep it off, here comes in the moment for using a really high quality HA filler and some Sculptra and some other modalities that we can use to lift and tighten that tissue. So I really love how everything like that is really super connected. I encourage people to look in the mirror and kind of ask yourself what's bothering you, what age related changes have you seen that you would like to potentially improve upon, and how are you feeling? Like, really take a good inventory of how you're sleeping, how you're moving, how you're feeling. Are you pushing your own needs to the side? Are you creating little habit goals for yourself that are going to end up equally. Do you even know what habit goals to what? Like, do you know why you need to drink water and why you need to potentially add some electrolytes and why salt isn't bad for you? All of the things that we will be able to educate you on. Um, so I just think that this podcast, I hope, was eye opening in terms of you having the power to take control and having a tool like the relationship with us to really take control of the aging process, to partner with our practice that prioritizes education, expertise, value, and to see if this is the place for you. We would love nothing more than to have the opportunity to talk to you. So, whether you're new and you've been considering coming in and seeing our providers, or if it's been a while and you're interested in how our practice has evolved, we're ready to help you evolve too. And so I just really thank you for tuning in. I'm sorry for my absence. I'm excited to get the Curated Beauty podcast rolling again for those of you that have been faithful listeners. Hopefully, you have clicked follow the show so that my new podcast episodes pop up for you. If this episode resonated with you at all, please share it with a friend, leave us a review, schedule an appointment. Until next time, remember aging may be inevitable, but with the right approach, it's a journey that we can navigate together with a lot of grace and a lot of confidence.